Go ahead, ma'am.
Good afternoon, everyone. Welcome to today's Facebook Live session. I'm Dr. Keerthana, consultant and fertility specialist at Oasis Tolichowki branch. Today, I'm here to discuss regarding the most common ART procedure that is which is done, that is intrauterine insemination. So, what is an IUI procedure? What are the prerequisites that are required for a couple to undergo an IUI procedure? And what are the indications? When is it done? And what sort of evaluation a couple will require before undergoing this procedure? And what are the precautions that needs to be taken during the procedure or after the procedure? What would be the expected success rates and how many cycles you can try, which are the common questions that I see couples asking. So let us discuss in detail about intrauterine insemination today. So basically, intrauterine insemination or artificial insemination using partner's sperm is that it is the around the time of ovulation, semen sample will be inseminated inside the uterine cavity after the sample undergoes laboratory processing. So it is a simple, most simple, cost-effective method to enhance the pregnancy chances in a woman who has got patent fallopian tubes. In this process, actively motile sperms they will be deposited into the woman's womb around the time of her ovulation. So, using a narrow, flexible, soft IUI catheter, processed semen sample, which is concentrated to a volume of 0.3 to 0.5 ml, which will contain actively motile sperm, they will be inseminated just beyond the level of the internal os inside the uterine cavity. So, before understanding the IUI procedure in detail, one needs to understand how natural conception happens as well. So, after intercourse, semen sample which gets deposited in the vaginal fornix will travel through the cervix into the uterus and through one of the fallopian tubes. It enters into the tube, and through one of the fallopian tube it will meet the mature egg that is that enters the tube once a dominant follicle gets ruptured or ovulated from the ovary. Through the fimbrial end of the tube, the mature egg finds its way into the fallopian tube where it meets the sperm. So ultimately, when the sperm is able to fertilize the egg, the resulting embryo then travels to the uterus and gets attached to the uterine lining. Thus, that is how it results in a successful implantation. So, after understanding how a natural conception happens, so we can discuss about the indications when are a couple eligible to undergo an IUI procedure. So, uh, when there is some mild male factor, say like the counts are borderline, there is mild oligozoospermia, or there is a slight decrease in the motility, mild cases of asthenozoospermia. In such cases, we advise the couple to go for an intrauterine insemination procedure. And the other indication is unexplained infertility. That is, the female partner has regular menstrual cycles, she's ovulating regularly, and at least unilateral tubal patency is demonstrated, and there is no male factor, but still the couple is not able to conceive after trying for 1 year of regular unprotected intercourse, or she takes some medicines for the egg to develop and rupture, and then a couple tries naturally with an ovulation induction timed intercourse cycles. Still, the couple is not able to conceive around 3 to 6 months. In such cases with unexplained infertility, we usually advise the couples to go for an intrauterine insemination treatment. Or in the other indication being the female partner having mild endometriosis. That is, how can we diagnose this based on some of her menstrual symptoms, like if she has severe painful menstruation, or if she experiences pain during intercourse, and we are able to see any small endometriotic cysts in the ovary, and her egg reserve is good and she's ovulating regularly. Such mild cases of endometriosis are also eligible couples to undergo an intrauterine insemination. The other reasons or the other indications being like any cervical factor or any immunological factor, like presence of having any anti-sperm antibodies. And if there are any coital issues, a male partner experiences any history of the presence of any erectile dysfunction or any ejaculatory dysfunction, or say in cases of premature ejaculation, couple can have this IUI procedure. In cases of we advise IUIs in some couples, like if they are serodiscordant, that is a male partner or one of the partner is HIV positive and the female partner is HIV negative. Uh, uh, because of the semen sample processing, and the virus is supposed to be present in the seminal plasma, so the semen sample preparation will eliminate the seminal plasma, that is the virus, and then the prepared sample will be free from the virus, which can be inseminated into the woman's womb, so that the seroconversion usually doesn't happen. So in such cases of a serodiscordant couple also, intrauterine insemination can be advised for. Or in cases of azoospermia, insemination can be done using a donor sample as well. So, what is the most important prerequisite for a couple to undergo IUI? After that, we come to know that the male parameters, the semen parameters, are absolutely normal, or there is mild male factor in terms of low counts or motility, and the female has regular menstrual cycles. The most important thing is that at least one fallopian tube should be healthy, patent, and functional, which is a prerequisite for going ahead with the IUI treatment. So, after knowing what are the indications, what are the prerequisites for a couple to undergo, what is the workup that a couple needs to undergo before embarking on this IUI treatment is that in a female, we will do some hormonal assessments during her start of the menses, that is in between her second to fourth day of her menstrual cycle, like the measurement of follicular stimulating hormone, luteinizing hormone, serum estradiol, and the test to measure her ovarian reserve, like the anti-Mullerian hormone. Additionally, to rule out any anovulatory infertility, it is important to have her serum thyroid as well as the prolactin levels also measured. And in a male, definitely properly conducted and properly analyzed semen analysis is also one of the important workup that needs to be done in a male. And test for tubal patency, which can be done either by a hysterosalpingography, or if a female partner has undergone laparoscopy for any other reason, wherein a chromoperturbation test also gives us the information about the bilateral tubal patency. And then couples blood grouping and the infectious disease screening is as well done, and then the couple is prepared for the IUI procedure. Basically, in a female partner, we start her ovarian stimulation. So, people tend to ask us, how can I increase my IUI success rate, doctor? So, what we advise them to have is by this ovulation induction medications, which are given simple medications which are given either orally or a small dose of injectable gonadotropin preparations are given for the development of more than one mature follicle in a woman's ovaries. So, having 2 or 3 dominant follicles instead of one, so that to increase her chance of fertilization, and never we have to hyperstimulate her, that is never uh, more than again 3 dominant follicles. So, and the other thing after ovarian stimulation is by doing a pelvic ultrasound or the follicular monitoring, which we can say is in a range of 3 to 4, that is 3 to 4 scans during her IUI cycle, just to monitor or to know about how the endometrial thickness is developing, whether she is having a trilaminar endometrium around the time of her ovulation with an endometrial thickness of somewhere close to 8 millimeters with a good blood flow, and to understand how the follicle is developing, what is the rate of the increase in the follicular size per day, or what is the vascularity that a follicle is receiving, when is the likely time of ovulation to happen, or when is the likely time that we can consider a trigger for a mature egg to be released, is by doing simple follicular scans around 3 to 4 during her IUI cycle. We get an adequate information regarding these events, and then making this dominant follicle rupture, by which a mature egg gets released. So this is done usually by means of a simple HCG injection, which is used for the final process of follicular maturation. So usually 24 to 36 hours later after the HCG trigger, ovulation likely happens. And the IUI treatment is usually synchronized in such a way that insemination is done around the time of ovulation. That is, once the ovulation is documented, partner's semen sample is taken, processing is done, and then inseminated inside the woman's womb. So when the ovulation is documented now, the partner is advised for a semen sample collection, which is usually processed inside the lab by an andrologist, either by simple wash or a centrifugation method. Basically, this semen processing or methods is required to eliminate seminal plasma, debris, or any other abnormal cells to separate them from a normal motile sperms. And also the advantage of these preparations is that it will also decrease what is called as a reactive oxygen species. So this inseminated sample will contain concentrated sperms or a motile sperms in a volume of that is concentrated to somewhere close to 0.3 to 0.5 ml. And then insemination is done in a preferably in a partially filled bladder, so that this partial filling will enable the straightening of the uterocervical angle, and then the negotiation of IUI catheter becomes quite easy. So a speculum is introduced inside the woman's vagina just to visualize the cervix, which is gently cleansed with a warmed normal saline, and then a narrow flexible catheter is negotiated through the cervix to deposit the processed semen sample inside the woman's womb. So, in a maximum possible atraumatic way, the insemination is usually done. And post insemination, the woman is asked to lie down for about 10 to 15 minutes, after which she can ambulate. And then luteal phase support, the most important aspect after the IUI. In case the ovarian stimulation is done with any gonadotropin preparations, the luteal phase support by means of vaginal tablets are usually advised in an IUI cycle. So after understanding how we start the treatment at the start of the menses by giving ovarian stimulation, making the dominant follicles develop, making them mature, rupture, and then doing the insemination, the semen sample preparation. So now it is important to understand what are the factors that affect the IUI success rate. So the most important factor is the age of the female partner. That is a young female with a duration of infertility being less than 5 years. They tend to have good success rate with an IUI cycle. And if we talk about the pregnancy chance per cycle with an IUI, it is somewhere close to 15 to 60%. And the cumulative pregnancy rate for about 3 cycles is close to 35 to 40%, after which the success rate usually plateaus. In fact, in a woman above 30 years with a fourth cycle of IUI, sometimes the success rate drops to as low as 5% as well. So, if a couple in a couple 3 cycles of IUI did not result in a pregnancy, it is ideal to try with the higher treatment options like IVF rather than attempting for the further cycles of intrauterine insemination. So, if we talk about the other factors which will affect the IUI success rate after the age of the female partner and the duration of infertility, the the other important prerequisite is the tubal patency, which has to be demonstrated at least on one side. And then what is the total motile sperm count? So after the semen preparation, that is post wash, a total motile sperm count, something close to 10 million, gives a pregnancy rate with an IUI of somewhere close to 50%, rather than having a total motile sperm count post wash, which is around 5 million. So TMSC definitely above 10 million gives a pregnancy rate of 50%, 15%, which gives a good chance, rather than a TMSC which is less than 5 million. And then after the total motile sperm count, what are or how many number of dominant follicles that have developed? So instead of one, having 2 or 3 dominant follicles, and never beyond 3 again, not to hyperstimulate the ovary. So if we have instead of 1, 2 or 3, the chance of fertilization or the chance in an IUI cycle is always better. So what are the after understanding these, what are the underlying factors in a couple? Any mild tubal factor, or is there any minimal endometriosis? That also needs to be checked. And after discussing what can be done to optimize success in an IUI cycle, so or put the discussion in the other way, what are the factors that can be modified, what are the factors that cannot be modified in an IUI cycle to optimize the success rate. If we talk about the non-modifiable factors that will affect the chance of pregnancy in an IUI, is that the age of the female partner, if more than 35, the chance of getting pregnant in an IUI cycle would be decreased. And the ovarian reserve, what is the ovarian reserve that a woman has, and having a borderline ovarian reserve and trying with multiple cycles of IUI also usually is not advisable. And what is the duration of infertility? If the duration of infertility is more than 5 years or more than 10 years, the chance with an IUI is usually less. And what is the etiology of infertility? Is there any tubal factor or any mild endometriosis that tends to decrease the chance of pregnancy in an IUI cycle? That also cannot be modified much. And how is the tubo-ovarian relationship? Is the mature egg after ovulation, is it captured by the fimbrial end of the fallopian tube? Whether the egg is entering into the tube, what is the quality of the egg after the insemination is being done, whether the sperm is entering into the tube and reaching to the site of the egg and able to fertilize the egg. This is all because they are not evaluated. This will all what is constitute the unexplained infertility. And then now, what are the modifiable factors? What can be changed to optimize the success is that the ovarian stimulation, that is to have more than one dominant follicle up to three. And then what is the ejaculatory abstinence? That is intercourse, having intercourse every alternate day. It improves the semen quality and increasing the IUI success rate also. So a couple is asked to have intercourse once every alternate day in an IUI cycle to improve the semen quality, not that the person will come directly on the day of insemination and give the sample. And the semen collection, whether the sample was collected inside the laboratory or is it a home collected sample, that also makes a difference for the motility, in fact. So usually with a home collected sample, the likelihood of success is quite low. And then the sperm wash technique. What was the semen sample preparation was done by a well-trained andrologist. So that also needs attention, because usually well-prepared sample, it will greatly increase the IUI success rate, because well-prepared sample usually has lower amounts of reactive oxygen species. And then the timing of insemination within 12 to 24 hours of the follicular rupture, whether the insemination is being done or not, and whether the post-wash total motile sperm count is something close to 10 million. And what was the technique of the IUI that was used? So, which are usually intra-cervical insemination or the intrauterine insemination. Usually with the intrauterine insemination gives a better success rate, and it has to be in a minimal invasive method or in an atraumatic way, not to stimulate any uterine contractions. And then procedure is the IUI procedure, whether it is being done in a partially filled urinary bladder, as we discussed that because of the straightening of the uterocervical angle, the cannulation becomes quite easy. And is the IUI procedure done under ultrasound guidance? In case of difficult IUIs, we can always do an ultrasound guided IUI just to ease the procedure. And then what was the type of catheter that was used for an IUI process? That is whether it's a soft catheter causing minimal trauma. That is also very important, because any trauma in terms like the catheter touching the fundus of the uterus will tend to cause uterine contractions, decreasing the chance of an IUI pregnancy. And then whether the insemination was done once, that is after the HCG trigger was done, 36 to 40 hours later a single insemination was done, or whether it was a double insemination, that is a double IUI. So the advantage with a double IUI is that more number of sperms are available around the egg around the time of ovulation. But always remember, the pregnancy rate is going to be the same, either it's a single IUI or with a double IUI. And yes, most important is bed rest mandatory after an IUI process. The female is asked to lie down for about 15 to 20 minutes after the procedure, but not later on. That is, the bed rest is not mandatory. And the luteal phase support. If injections are given during ovarian stimulation, that is, if you had gonadotropin injections, if you have taken gonadotropin injections during your ovarian stimulation, it is important that the luteal phase support that you receive should be in the form of a vaginal progesterone to increase the chance of implantation. So this is all about the IUI procedure. What is the actual process? What are the indications? When do a couple is advised to go for an IUI? And what are the prerequisites that have to be taken before starting an IUI treatment for a couple? And how the procedure is done, starting from ovarian stimulation, the trigger, the insemination, the luteal phase support, what are the factors that increase the success rate, what can be changed, what can be modified to optimize the success. So this needs little understanding before a couple want to come for an IUI cycle. So thank you very much. If you have any questions, we are open to. How long does it take to get pregnant with an IUI? So as I told you, one cycle of IUI, the pregnancy rate is close to 15 to 20%. So a couple can try for around 3 to 4 cycles of an intrauterine insemination cycle because the cumulative pregnancy rate, 3 cycles put together, gives you somewhere close to 35 to 40%. And yes, definitely after third cycle, the success rate in a woman with advanced age above 35 in fact drops to less than 5% as well. So ever attempt an IUI cycle for more than 3 cycles in a woman with advanced maternal age. So 3 to 4 cycles you can definitely try. Is the IUI painful? Definitely the procedure of IUI, we see to that it is non-traumatic just to increase the success rate. 1 or 2 doses of gonadotropin preparations is minimally painful, or as such an IUI procedure is not painful. Is bed rest required after IUI? So immediate post insemination, a woman is advised to lie down for about 15 to 20 minutes, after which she can ambulate, but throughout the next 14 days or throughout her luteal phase, bed rest is not mandatory. It is in fact contraindicated. She can resume her routine household activities. She can resume her work, and there is no restriction in terms of any physical activity as well after the IUI. Thank you so much.